Everyone, I'm here to present on the topic Ayurvedic strategies in the management of diminishing ovarian reserve. Diminishing ovarian reserve is a condition in which the ovary loses its normal reproductive potential, compromising fertility. The term refers to three related but distinctly different outcomes, that is, reduced oocyte quantity, quality and reproductive potential, and also abnormal ovarian reserve tests such as low AMH AFC. In Ayurveda, it can be related into as Dhadukshaya Bandhida, Artavakshaya or Nashtartava conditions. So in this presentation, we shall now highlight on three cases with different DOR features managed under Ayurveda protocol. To first case, the patient of 34 years came to with the presenting complaint of anxious to conceive for 8 years, irregular periods, severe lower abdominal pain, unsuccessful IVF and endometrial cyst. And in her, internal medication of Indukandam Kashayam, Snehapana, Virechana and Madravasti in Pipalyadi Anuvasana and Mahanarayana Taila was administered. And as follow-up medication, Tila Taila and Bhavita Shatapushpa Churna and Abhyarishta and Kumari Asava was administered in the patient. And see, the AMH and FSS level did improve in the patient before treatment. And now, after treatment, it had drastic change. The symptomatic relief and IVF also was successful in the patient. Next case of a patient of 31 years came to the OPD with irregular periods for about 4 years, oligomenorrhea for 4 months, early menopausal symptoms and USG indicative of DOR. And in her, internal medication of Guduchadi Kashaya, Kumari Asava was given and classical Vamana therapy was administered in this patient. And Yogavasti in Mahanarayana Taila and Erandamuladi was done. And as follow-up medication, Kalyanaka Kashaya, Kulathadi Kashaya, Abhyarishta Kumari Asava was administered in the patient. And the patient achieved periods in just 1 week after the administration of Vamana therapy. And the symptomatic relief was seen in the patient. The next case, patient of 36 years came to the OPD with a complaint of anxious to conceive, then lower AMH, IVF unsuccessful, endometrial cyst and chocolate cyst. In the patient, the internal medication given was Vaishwanara Churna, Snehapana in Summara Ghrida, Virejana in Gandharvahastadi Eranda, and Mustadi Rajayapana Vasti was administered in this patient. And as follow-up medication, Shatapushpa Churna, Phalasarpis, Mahanarayana Taila was administered. And AMH from 0.8 to 2.6 was the increment obtained after treatment. And thereby the IVF was successful in this patient also. Now, to mode of action of some of the important medications that have been used in this treatment. First, to Mahanarayana Taila. As Bhaishya Ratnavali says, Prajastapana, Balya, Rasayana, Vatanulomna property help in the correction of HPO axis and ovulation. Bandhyachanari, Lakhateja Putram thereby. Next, to Mahakalyana Grida. Its properties like Yonidoshahara, Vrishya, Garbhastabaga property help in inducing ovulation. Then to Shatapushpa, as Kashyapa Samhita says, Ritu Pravartini Dhanya Yoni Shukra Vishodhini. Yes, it do help in the pushti of Rasadhadu and thereby the Artava. Then to Sukumara Grida, Nirnam Stri Vrinda Bhartranam Alakshmi Kali Nashana. Its properties like Balya, Vatanulomana, Rasayana help in the relief of menopausal symptoms, early menopausal symptoms. And finally Phalasarpis, as classical references say, Pushpe Pide Phalayet, Maryamana Prajanam cha, Garbhinam cha Pujidam. Yes, it's Garbhada, Pumsavana, Balya property, help in folliculogenesis, follicular maturation, fertilization and thereby implantation. And thus, we can say that Ayurvedic strategies do aim at Deepana Bhajana, thereby Shodhana Dipanchakarma and Shamana Ushada in production of Avyapana Garbha Samskara. That is, stimulation of ovary for healthy oocytes. As Sharakacharya have said, Strishu Pritar Visheshena, Strishu Apatyam Pratishtidam, Dharmartha Strishu Lakshmishcha Strishu, Loka Pratishtida, Surupa Yauvanasthacha Lakshanarya Vibhushita. Yes, Stri is the one who is capable enough at producing Shreyasi Praja, and thus her health is of prior importance. And hereby we can conclude that Ayurvedic strategies do have higher success rates in management of diminishing ovarian reserve. Thank you.